afternoon, ladies and gentlemen. Welcome to show Lifestyle with Dr. Moby. I'm Dr. Moby here, and today we're going to discuss an important topic. And today's topic of discussion is mood disorder, especially depression in elderly. So today we're going to talk more about that, depression specifically. It's very important because a lot of patients, especially above 65, have lot of depression disorders, more than probably 10%. They are not getting properly diagnosed and they are not getting proper treatment. So it's very important that we educate everybody about depression, this great symptoms and what are the common problems and how to handle those. So we have great guests today, and that is Dr. Jamil Ahmed. He's board certified in Geriatrics and Internal Medicine. Welcome, Dr. Jamil, to our program.
Thank you.
Tell us a little bit about yourself. What do you do normally?
Well, I'm an internist. It means that I take care of adult patients, and I'm also certified in geriatrics, so also have a lot of geriatric patients. That means anybody over age 65, and that involves patient in a nursing home and home. So it's a wide scope of patients.
Yeah, great. So tell us a little bit about depression. Where do you see in practice of geriatrics this big disorder stand?
Depression is very common. It's been like that for ages. And sometimes people say that this is a disease of civilization, like diabetes, hypertension, obesity. Depression is also getting worse. That's true. But as you say, it's been with us for thousands of years. When you go back to the history of how long people have the problem like this, like a depression, in that part of the world that now we call Iraq, next to the Tigris River and the Euphrates River, there's a large civilization. And they mention about depression. They didn't say depression itself, but they mentioned about melancholy. So essentially, I think that's what they meant.
Okay, they meant, okay. So that is more of, with the depression, it was very prevalent even in older civilization, what you're trying to say.
At that time, they are a prosperous country or civilization. They are good in math. They develop concept of time, will, map, and concept of writing. It, almost like we are now, and that we all owe to them. And also with that, they had that issue of the depression. And they knew that this is not a physical problem. So when people used to get melancholy, they didn't go to a doctor.
Oh, they won't.
They went to a priest and or somebody religious person, because they knew that it has something to do with the issue of the brain.
So they thought it's more of a problem with the brain rather than a disorder.
And at that time, there was a lot of ignorance or lack of knowledge. They always thought that this is something to do with the demon. So you have to go to the priest to get the demons out. So, even in a period of Rome, but they are not as good as like earlier civilization, but they were very rude or tough. They treated these people with a psychiatric illness, with starvation, shackled them, beating them. They developed the concept called lunatic asylum. And Hippocrates, Hippocrates was one of the men who actually fought against this concept, but he lost because he was only few among thousands.
So then it was, what you're saying is at that time there was not much emphasis on clinical depression and so forth. So over ages it has probably evolved more now and more clinical. So tell us a little bit, what is the difference between, so normal depression with aging is not synonymous with depression, right?
No, depression is not normal.
Okay.
It's people just get older doesn't mean they have to be depressed. And there's a lot of things goes on life. Just give an example. Suppose that Mr. John had a stroke, and then his wife was sick and she died. She decided that she's going to go to Florida or some country where he doesn't know, and because he wants to get away from them. These things will make depression worse. One is illness, then loss of family member, then going to a place that you don't know, losing all the friends. So there's a lot of component in depression that I see that happening to people as we get older, and somebody getting sick. So it is expected, but at the same time, it's not normal.
It's not normal. So what are the signs and symptoms for audience, if we can emphasize what they should be looking for somebody with depression, what things they need to look for?
As I am trying to tell that, it is not normal.
It is not normal.
Everybody gets sad. Sadness is a part of our life. You lose somebody, you get sad and maybe feels depressed. But short period of time, maybe 1 week, 2 weeks. If it runs for a month, then that is not normal. Sometimes how they will say that I'm depressed, nobody will tell that I'm depressed. They will say that, I feel worthless. I feel helpless. And they are restless, they lost interest, the thing they love to do, they don't do it anymore. Or say that I always have a headache, that I never had a problem. Or I start to gain weight or losing weight and being forgetful or pain. Sometimes they have a non-specific pain. They will go from doctor to doctor, go to the emergency room, and the underlying problem is depression. So that's how they do.
So they will have multiple pain in different areas, and they will have lack of energy, not ability to do things much. They will be sitting in place for a long time and really feeling down and won't be talking much. So unfortunately, that's gonna really is very prevalent. So to differentiate that,
the duration, how long it lasting. If it's for 1 week, it's okay. If it's 2 weeks, probably not okay. And there's few diseases that will make you prone to have a depression. Like somebody has a stroke, probably has something happens to the brain from the stroke that people get depressed, or having a MI or heart attack, or had a bypass surgery. For some reason they get depressed, and they for heart-brain connection. And people have the cancer or chronic pain, Parkinson's disease that affects the brain part, and they get depressed, or multiple sclerosis. So, and you expect that they should, but they do more than it should. So these are the few medical problems that can put you to a depression for good reason. Yes.
So stroke is one, the heart attack and vascular, and then there is also dementia, diabetes. So those really affect them to a big degree, and they will be progressing toward depression, or it can coexist. So also a lot of with sleep problem, with sleep apnea, can coexist with depression and mood disorders. So those are very important. Make sure those rule out causes. Also check your thyroid, vitamin levels, and so forth. So let's talk a little bit about those diagnoses and symptoms we already explained to the audience. So where do you think the family support is important here in this beside diagnosing?
Family is very important. Family is important. Exercise is important. Good nutrition is important. So, and some sort of stability in the family is important. But if you think that how many people have depression, expect with this coronavirus that going on, and the stress involved, being isolated, these people are at risk if you have some inclination to have depression. They say that 2 to 10% people have depression. That's a lot of people in this world. And if you are in a nursing home, that or going to the hospital, your rate goes almost like 3 or 4 times. So it is not uncommon in depression, uncommon being depressed in the hospital. Although once they get out, they start to feel better. But there will be some risk factors. Who will be in that group that put you them? Suppose if you're a female,
so female
has a more risk for being depressed than man, and social isolation that's happening right now, divorce, being a widow, or lower socio-economic condition, a lot of medical issues like heart attack, Parkinson's, multiple sclerosis, or any chronic disease or arthritis put you at risk. Or if you have a problem with the insomnia, that will put you at depression risk. And a lot of people having dementia, it's a disease of the brain, that you lose a memory, they also get depressed more than other people. So that's one way to tell that some of the disease has more risk to be depressed.
So tell us a little bit about also pseudo-dementia, which is also we nickname with depression. People can exhibit some of the signs, symptoms of dementia. Actually, they have depression. Their cognitive decline could be sudden, and then which is the ability to actually concentrate, memorize things, can go really downhill. So if you suspect that, make sure talk to your doctor and see that they can differentiate between those two conditions.
Yes, pseudo-dementia is not uncommon. Anytime people come with an issue of memory, we always make sure that patient doesn't have a is not depressed. Then you make sure that he doesn't have any nutritional deficiency that will put at risk for depression. You know, psychiatrists always classify everything.
Yeah.
And they have a very big book and has the numbers, and they say that thousands of diseases are classified that way. You know, one of them is a major depression. That is always depressed.
Always depressed.
And they have some people have seasonal. They are not bad. And some people have a depression with a psychotic. And then there's a depression that comes with a stroke or vascular dementia. So, and lastly, dementia with Alzheimer's disease. And so it is a big thing, but you have to classify what kind they are. And there's a lot of comorbidity. As I was telling you, that it has a depression and the stroke.
Sure.
MI and depression. There's a risk is almost like 3 or 4 times. So anybody having this type of problems, and we have to keep an eyes open to make sure that he's not going towards depression, that you can do something. If we are depressed, nothing goes right.
So tell us also a little bit about what are the more treatments or therapy sections, if general treatment, and then we talk a little bit about medication. So what are the general eating, balanced diet, exercise, sleeping better, that will help?
Yes, health, your general health is very important. If you have a chronic disease, you have to have. And once you have a chronic issues, it's very difficult to reverse it. So it is better that you take care of yourself before it all starts. If you have a diabetes, make sure that you control your sugar so they don't get complication. You do exercise so that you don't get heart issues. And one thing with depression is suicide.
Yeah.
If you think that somebody has a depression, we always ask the question, do you have any issue with ending life? Some people think that is the wrong thing to do. You're giving an idea. Actually, it is reverse. If you ask them that are you depressed to the point that you want to kill yourself, they tend to not do that.
Oh, good.
Compared to if you don't say nothing.
Nothing. So all the primary cares and everybody, even family members, they should ask this question that, are you suicidal or are you depressed, sad? So basic questions we can ask actually at every visit, or even family member can help, and it actually helps to. It's not gonna trigger suicide, but suicide is the main thing we worry also about beside treatment. So the suicide risk is actually so high in elderly. It is has poor prognosis. So which means that if we don't diagnose early and intervene, they will kill themselves. So that's unfortunate, but that's true. So
Especially the male.
the male.
Yeah, male usually do not attempt to kill themselves, but if they do,
They are more
frequently they are successful. Compared to the female, they will do 10 more, but they usually survive. So, good and bad.
that good.
So if you want to think that, ask how you diagnose. So, you ask them, are you feel all right? And do you cry a lot? Do you feel that your life is worthless? Or there's a change of situation in your home? And so you ask them a lot of questions, series of questions. They call there's depression scale for geriatrics,
Okay.
GDS.
GD.
And they have a series of questions. Like I just give an example. Are you satisfied with your life?
Okay.
Are you satisfied with your life? If you say no, you get 1 point.
Okay.
And if you say you feel empty in your life, if you say yes, then you get 1 point. And then, did you lost a lot of hobbies or interest in your life? If you say yes, then you get 1 point. So you calculate like this, and if you score more than 5, then probably you have depression. If you score more than 10, that's likelihood that you have a depression is pretty high. So when you found that probably has a depression, you tell them that most likely you have depression, but you have to find out why.
Why?
And one is a disease that I told you that can have, like if you have MI, stroke or something, you can get depressed. A lot of medicine that we take every day can cause depression.
So that will, okay. So those are certain medications. So we really have to go through number of medication. Please go through the list. A lot of doctors and they will keep adding medication. We really have to answer one basic question: do they really need that medication? A lot of have side effects, especially mood disorders, and they will really get them down, or they will just make them very dry and really not moving much. So please pay attention to the number of medication. The interaction numbers goes high, which means they get the bad side effect from interacting with each other. So make sure we are working on that and making sure the family knows, patient knows, and then we can get those lists cleaned every visit. Okay.
Yes. So when you go to the doctor, you take a list with.
Yeah.
And doctor usually look at those things, and especially if you think that you have a depression, he will look into those medication to see which one can cause. Just give an example or few examples. Almost everybody has a blood pressure nowadays, issues like hypertension. Catapres is a medicine that often used.
Yeah.
It is known to be depressant. Like Indorol, that we use all the time. Thiazide is a water pill that is the first line of treatment for blood pressure. Can cause depression if somebody has a risk for depression. Or Digitalis or digoxin, and we don't use that digoxin that much anymore because of the difficult to control the blood level, and you have other safer medicine available. But if you have a digoxin, probably think about it whether you can change it to something else. A popular medication is Zantac. Is known to cause depression, like anti-Parkinson's medicine. Parkinson's itself can cause depression. The Parkinson medicine can cause depression, like amantadine, or a levodopa, common medicine for Parkinson's. Some of the seizure medication that we cannot live without, like Dilantin, Primidone, Phenobarb, or Tegretol, all can cause depression. So it is difficult to not to take this medication, because if you have a seizure, what are you going to do? But then you have to take some medication to control the depression. And chemotherapy is a known antidepressant. Even the benzodiazepines or Xanax or Ativan, medication like that can cause depression, although it might help with your anxiety.
Yeah.
So it is a difficult choice to give anxiety medicine. At the same time, we thought it might make the depression worse.
Also, let's talk a little bit about treatment, and then we'll summarize for audience. So give us some of the treatment options available right now.
First of all, you have to make sure that the patient is not suicidal.
Okay,
so you ask them.
Okay.
You try to minimize the risk for depression, like make sure that he is sleeping well or she is sleeping well.
So get adequate sleep.
Yes, and discontinue medication that will cause depression. If you're using alcohol, try to stop it, because alcohol is a depressant. Then you check for thyroid, check for diabetes, which are risk for depression. And if you have a chronic pain issues, that needs to be treated, because without treating pain, it will be futile to treat depression. And exercise. You know, Avicenna or Avicenna, one of the famous quote for him was, "You can replace a lot of disease by exercise." So Avicenna is a doctor, and he was a very big proponent of exercise, and he thought that it will help with the depression too.
Okay.
And he was probably right.
Okay.
Then comes the psychotherapy. Psychotherapy, you know, you talk to the psychiatrist and the psychologist. They talk about and give biofeedback and things like that, which works. Medication works. Medication and psychotherapy works together better. So there is a difficulty with compliance with antidepressant, because once you start to feel better, you stop it. So there is a different kind of medication. I don't want to give too detailed, probably you should talk to a psychiatrist to discuss the medication. The common medications are SSRI or citalopram, and it is a good medication. It's been tried for a long time, and problem is that, you know, it can cause increased fracture. It can cause tremor or shakiness. Some people have difficulty with eating because they become anorexic, or have a bradycardia or slowness of the heart, to the point that you think that you might need a pacemaker, but no. If you stop citalopram, it will reverse and it will get better. Then another group is called NSRI, or serotonin non-epinephrine reuptake inhibitor. So those are also, they call commonly we have Effexor or Cymbalta. Those are good medication, but you have to be very careful about side effects. And in nursing home patient, they don't tolerate Effexor well. So in older patient, probably SSRI is a good choice. At the same time, you have to think about side effect of the medication. They call serotonin syndrome. It can cause confusion, tremor or shakes, muscle jerk, temperature. So these are all medication that works, but you have to be careful.
Okay. Also, tell us a little bit thoughts on ECT and transcranial MRIs, those they're doing the MR therapy,
You know,
TMR.
there's a place for ECT, and some people would not respond to anything, and those people do well with ECT. It's nothing to fear about, because you know we have seen movies that how cruel the procedure are. It's not that way anymore.
So it is TMS, I think, is nowadays trans MRI
Yes.
stimulation, magnetic.
It's not done everywhere, so
But have you seen any good results?
there's some results.
Okay, great. So let's summarize for our audience. So make sure, first of all, we have to be vigilant. The first basic thing is that age is not synonymous with depression. So we have to differentiate. So anybody can be depressed for a short time, but if it keeps on going, and these symptoms, especially, they are really not participating in things which they were doing, and then not talking, not moving around and in the bed or chair for too long, and not participating, feeling guilty, sleep issues, and if they have recent stroke, heart problems and so forth, diabetes, undiagnosed or newly diagnosed, we have to look for problems. Also medication wise, make sure the medication which are really absolutely necessary, and look for the symptoms. If they've started on new medication like we mentioned, and they might have the side effect of causing depression, and some of the over-the-counter medications, Zantac, which some people were using, can cause a lot of that. So over-the-counter medication and the prescription medication are very important. Get the labs, blood work, talk to the doctor about medications which can be safely used, and we talk a little bit about those classes, and we'll encourage that to discuss with your doctor and psychiatrist if it's getting worse. Comorbid conditions, very, very important. Pay attention to those. If there's sleep problem, get evaluated for sleep apnea, and if it could be treated, great. So that's another thing. Final thoughts, Dr. Ahmed?
Depression is not normal. It is not part of the aging process, and it is not a craziness. People have a fear that if I tell that I'm depressed, I'm weak. A lot of famous people in this world had depression. So it is nothing to worry about. And if you need help, you should ask for help without any fear, because people have understanding that how difficult it is to live if you're depressed and being lonely.
And also get support group with family, friends, and the NIH and a suicide hotline. So if you're suicide, make sure you get help. Okay, support group. Very, very substance abuse is very important. Alcohol detox, whatever we have to do. So alcohol is not the treatment. Please do not take alcohol to hide that. It actually makes it worse. And do not use with medications, antidepressants especially. So with those, give us feedback, give us your comments, and always pleasure watching and these comments popping up and getting feedback for our audience.